Short video on thoracic outlet syndrome, since we see quite a few people with signs and symptoms of thoracic outlet syndrome. Um, so I'll talk about why people get it and the treatment options. Thoracic outlet syndrome is a condition where there's three potential structures that get involved in the syndrome. So the most common is called neurogenic. It's the nerve that gets involved. Essentially, there's a little triangular area in above your clavicle where the three structures that bring blood supply and drain the venous return and the nerves to that arm come through this tiny area in the above your clavicle, and that's where they get compressed a little bit depending on the anatomy and can cause you symptoms. So the most common symptom is called neurogenic claudication. Typically, it involves what's the ulnar nerve, and the distribution is on your fourth and fifth finger. You get tingling and numbness. Now that's to be distinguished from carpal tunnel syndrome, which is a compression at your wrist. So this is a compression up here, again, because of the anatomic structures. And so you can get pain, numbness, and tingling down your arm. It can be quite severe. And, the typical person that gets it, although not necessarily that way, is the slighter, thinner person, or sometimes the heavy bodybuilding kind of weightlifting guys who do a lot of military presses, above the shoulder stuff, which, by the way, is terrible for your shoulder if you're older like me. I learned that the hard way. So neurogenic means nerve compression or nerve symptoms. And so that's the most common symptom. Then there's other the vascular system, the arteries and the veins. So the arteries, the blood supply to the hand. You can get symptoms in your fingers where you start to get a lot of cramping when you use your hand, especially if you turn your head away from the direction of your hand. So if I'm having it in my left hand, I turn my head to the right side, I start to get symptoms in my left hand. In fact, that's kind of one of the tests we look for, is if you lose your pulse when you turn your head the other way. So arterial, the blood supply to the hand, and then venous, the vein return back, swelling in the arm. So that can be asymptomatic, meaning no symptoms, or it can lead to clotting of the arm vein, where the entire vein clots off because it's compressed. Remember, the vein blood in your arm is trying to go back. If it meets a compression point, then it can be so slow flowing through that area that you clot a vein, and the symptoms of that will be significant arm swelling all of a sudden. And that can be treated with standard kind of treatments. But anyway, those are the three types of thoracic outlet syndrome. The diagnosis is made by history and physical examination. There's some neurological testing you can do for it, for the neurogenic. For the arterial or the venous thing, you can do a CT angiogram or even a venogram or arteriogram to diagnose it. And then, depending on your symptoms and how long it's been present, you can avoid the military exercises, military presses, go through therapy, see if it helps you. And then the last option is the surgical approaches. There's some people doing angioplasty of the veins for this. I really don't know how good those results are, but generally speaking, if you've got a clotted vein, then you can go through an unclogging of that vein with medication, with a catheter, and then be put on blood thinning medicine, and then you need a surgical approach to decompress that area. And there's guys in your town, who do a lot of them. You want to see a guy who does a lot of them. You don't want to see one who does once in a while procedures like that. In Dallas, there's a guy I know who trained me, does a ton of them. So those are the kind of people that I think need to be doing them. But the arterial issue, now that can have some potential devastating kind of consequences. Not always, but I remember years ago that Houston Astros pitcher, J.R. Richards. See, he had a stroke because he had an arterial, from the repetitive kind of the motion of throwing a baseball. He had thoracic outlet syndrome, which led to an aneurysm of his subclavian artery. And if I remember right, he passed some of that clot up into the back of his brain, had a stroke. So the J.R. Richards is an example of an arterial, is athlete, famous athlete who had arterial thoracic outlet syndrome. There's been venous thoracic outlet syndrome. I think one of the Hanson brothers had that happen. That band, the Hanson brothers. I think one of them had a venous thoracic outlet syndrome, if I remember right, and I read that in the papers. So the most common, again, to kind of summarize, the most common is neurogenic, history and physical examination, some testing, and then if physical therapy fails, surgical treatment. The surgical treatment, just FYI, again, you really need to visit with somebody who does a bunch of them. First rib resection, taking out some of these muscles, maybe just kind of opening up that space so that there's no compression on these structures. And the results are pretty good. You have to kind of visit with somebody who does a lot and kind of go through the steps before you have the surgical approaches. But thoracic outlet syndrome in a nutshell, fairly, I wouldn't say common, but we probably see a few of those at least a year and very treatable. Next time we'll talk about acute aortic dissections. Those are the conditions that sometimes need emergent or urgent treatment, and that's separated from ruptured abdominal aortic aneurysm. So anybody who has an acute dissection doesn't necessarily have a ruptured aneurysm. Or anybody who has a ruptured aneurysm doesn't necessarily have an acute dissection. So there's a lot of confusion about the terminology. We'll go over that next time.